I noticed some similarities when watching the videos, reading the articles, reading the textbook about burnout in the context of healthcare providers. One of the first things that I noticed is that they all talked about one of the causes of burnout is not having enough resources. One of the examples that really stood out to me was of a doctor in Zimbabwe who talked about how they didn't have enough personal protection equipment. And so a lot of the workers there didn't feel safe because they just had to reuse aprons and masks, and they weren't provided because they weren't considered a COVID-19 hospital. And so they didn't feel safe in their work environment. Another crazy example from this hospital is that they didn't have a ventilator, and there was a patient who could have survived if they'd had access to a ventilator, and actually their family came and brought one to the hospital, but they couldn't use it because there wasn't an electrical socket in the room. And so they didn't have the resource to even use the ventilator that they provided. And so this patient died. So whether it's not having enough staff or not having enough protection equipment or medical technology, medical tools, there were a lot of places that just didn't have enough resources. Another thing that all of the resources today talked about was that their jobs are highly stressful and mentally taxing, and that contributes to burnout. So, they would be watching people die alone every day that couldn't say goodbye to their families because they couldn't have anybody around. One person said that it felt like a horror movie because they were all suited up like you see in movies. Another person talked about seeing freezer trucks full of bodies because they had just so many people dying all the time. And one thing that somebody mentioned is that, all these healthcare providers that were working during COVID, they didn't sign up to work during a national or during a global pandemic. Yes, they did sign up to save lives and, practice medicine, but there's no way you could predict this global pandemic happening. And so it was very hard for people who expected their normal day to day that they'd, the job they've been working for years and years and years, and then all of a sudden it's much more intense and much more mentally taxing. There was also an example of someone who works with people who have lots of mental illnesses or paranoia, and they're being forced to stay inside all the time, which normally they're encouraging them to, get out and experience life and conquer their fears and stuff. But during COVID, you had to tell them, no, actually, you do need to stay inside all the time. And that only increases their fear and paranoia. So very mentally taxing, which can lead to burnout. Another thing is that one of the symptoms of burnout is becoming numb or doing monotonous activities that can lead you to become numb. So I mentioned the freezer trucks earlier. I can't imagine just seeing freezer trucks day after day that you have to fill with the bodies of the people who are dying. And people can become numb to it. It's so traumatic that you kind of just become numb, or you're hearing code blue all the time. Sometimes you can just experience apathy when you're experiencing burnout, and it's hard to complete your typical job tasks because you just don't have the mental capacity to care anymore, which is sad. Another thing that happened is that caregivers became ill. So they would develop COVID, the same disease that they've been seeing all these people die from. And it's very scary. And even those who didn't get COVID could have symptoms of, headaches, bowel issues, just changes in their sleep habits just from all the stress of their job. So I think that's something we can take away from all of these people's experience is that we need to have programs in place to care for the caregivers. There are employee wellness programs that are in place or that are in the works. And I think this is really important. It's really important to consider the needs of the caregivers, the providers, and to listen to what they tell you they need. If they don't feel safe, something has to change. If they don't have the supplies they need, something needs to change. And I think the pandemic illustrated a lot of strengths and a lot of weaknesses in our healthcare system. One of the strengths, I think, was just how much people are willing to sacrifice and adapt. A lot of people took on roles that they normally wouldn't. I think it also showed supply chain issues and a shortage of employees, caregivers. It exposed burnout and not really a way to compensate for it. A lot of people were really overworked and getting really exhausted and apathetic. And I think it's really important to address burnout because there's already a predicted shortage of providers and nurses in the future. And when people are short-staffed, it's so much harder to keep going because you're having to take on the work of so many people. And it would be easy to just quit and to try and find work somewhere else. And so I think, when people are short-staffed, it just exacerbates the burnout problem. And so burnout is a very important thing to address in the future if we want to take care of our healthcare providers.